Hello, hello friends. Welcome to a new lecture today on MCQs of stomach. So, duodenal blowout is seen on which post-operative day? Duodenal blowout is most commonly seen on 4th post-operative day. This incidence of this duodenal blowout or duodenal stump blowout is decreased due to different techniques of stump closure. So question number 2. Early gastric cancer is limited to involvement of mucosa and submucosa with or without lymph nodal involvement. So mucosa and submucosa involvement is called as early gastric carcinoma. Then question number 3. False about gastrointestinal stromal tumor is. So, if you see the options, most common in duodenum, false. Gastrointestinal stromal tumor, around 50 to 60% it occurs in stomach, 30% in small intestine and only 10% in colon. The most common site of gastrointestinal stromal tumor is the stomach. Then, in gastrointestinal stromal tumor, necrosis and ulceration is present. True. PET scan can be used to assess the response to therapy. True. Well circumscribed lesion. Yes, true. This PET scan is used to assess the response to therapy with imatinib mesylate. Right. Then, question number 4. Surgery for perforated duodenal ulcer is. Surgery for perforated duodenal ulcer. So, vagotomy. See, already the ulcer is perforated. So, first and foremost aim of us is to treat the perforation to make the patient hemodynamically stable. So, vagotomy has no role. Pyloroplasty also has no role. The main treatment is omental patch repair. Here, we will have to repair the perforated part and then put an omental patch to close the defect. This procedure is called as modified Graham's patch closure. Then, if you see, the most common site of perforation of peptic ulcer is duodenum, and in the duodenum the first most common site of perforation of duodenum is first part of duodenum, and among the perforation anterior perforation is most common. Then question number 5. Most common site of cancer stomach is. Most common site of cancer stomach is antrum. See, overall most common site of cancer stomach is antrum. Most common site of cancer stomach in pernicious anemia is fundus of the stomach. Most common site of lymphoma is antrum. Most common site of lymphoma in Burkitt's type of lymphoma is body of stomach. Most common site of gastrointestinal stromal tumor is proximal stomach. Then question number 6. Correct about duodenal ulcer is. First statement. Duodenal ulcer is never malignant. True. Gastric ulcer. In gastric ulcer you see 0.5 to 1% of malignancy, whereas duodenal ulcer is never malignant. Then statement 2. Most common site of duodenal ulcer is in second part of duodenum. Actually false. Most common site of duodenal ulcer is first part of duodenum. Common blood group is blood group AB. No. Common blood group is blood group O. GI bleed is not seen. Actually, GI bleeding is the most common complication leading to death in duodenal ulcer. Then, question number 7. Complications of chronic duodenal ulcer are all except. So, If you see the questions, options, bleeding, stricture and perforation are the complications of chronic duodenal ulcer, whereas malignancy is not a complication of chronic duodenal ulcer. Among all these causes, if you see, bleeding is the most common complication of duodenal ulcer. But if you are asked what is the complication of duodenal ulcer which has highest mortality rate, the complication of duodenal ulcer with highest mortality rate is perforation. Most common indication for surgery in duodenal ulcer is bleeding. Okay, next question number 8. Which metabolic abnormality is seen in congenital hypertrophic pyloric stenosis? The metabolic abnormality in congenital hypertrophic pyloric stenosis is hypokalemic, hypochloremic, hyponatremic metabolic alkalosis with paradoxical aciduria. So in the options, it is metabolic alkalosis. So it is hypokalemic, hypochloremic, metabolic alkalosis with paradoxical aciduria. Then question 9. Gene involved in carcinoma stomach is. In carcinoma stomach, we have the gene APC is involved. See, what are the genes involved in carcinoma stomach? E-cadherin mutation, APC gene mutation, microsatellite instability, P53 mutations, P16 mutations, CERB-B2 mutations are involved in carcinoma stomach. Whereas c-KIT mutation is involved in gastrointestinal stromal tumor. Then question number 10. In celiac artery compression, the structure that causes compression is celiac artery compression, or we can call it as Dunbar syndrome. In celiac artery compression syndrome or Dunbar syndrome, median arcuate ligament is compressed mainly. Here in celiac artery syndrome or Dunbar syndrome, median arcuate ligament is compressed. This celiac artery syndrome, Dunbar syndrome or median arcuate ligament syndrome is characterized by postprandial abdominal pain, weight loss and abdominal bruit. Diagnosis is by barium studies and CT angiogram. Treatment is you should release the arcuate ligament by surgery. Then question number 11. True about congenital hypertrophic pyloric stenosis are all except. So we will have to find the false statement. First, Ramstead pyloromyotomy is done. True, it is the treatment of choice of congenital hypertrophic pyloric stenosis. Non-bilious vomiting. True, it causes non-bilious vomiting because the obstruction is in the distal stomach and bile is secreted in the duodenum. So obviously you see non-bilious vomiting. Metabolic acidosis occurs. It is false. Actually, it causes metabolic alkalosis with paradoxical aciduria. This congenital hypertrophic pyloric stenosis is most common in males. True, it is most common in males. Preferably, it is most common in firstborn males. So this is about the multiple choice questions in stomach. Thank you guys for watching my lecture. Thank you.